So children don't want to speak. Yeah, pretty commonly. Yeah, pretty commonly. So mainly problems. Yeah, mainly problems. Poor appetite. And they don't like to eat. Yeah, nothing interesting. Yeah, nothing interesting to like children to eating. And don't like eat any kind of food. So that's generally problems. Yeah, generally problems. So severe kind of poor appetite. Yeah, severe kind of poor appetite. And amount, yeah, the eating amount reducing gradually. And some people just eating pretty small amount of food each time. So that's pretty commonly in the children. It happens on the any age, but generally say is between 1 to 6 years old. That kind of children pretty easily cause these problems. So onset usually is slow, and gradually they eating less and less. So that's the problem. Yeah, that's the problem. Right now we're talking about it happens in the children, but truly it possible happens in the adults. So for the adults, pretty commonly, like people try to control their body weight. Then they try to eating less and less. And finally, they totally no interest in for the food. So that happens for the adults. But for the children, the reasons not that clear. Yeah, not that clear. So maybe have a lot of reasons, like sometimes it's the parasites inside, and sometimes people just pick up special kind of food. But whatever, like gradually people losing interest in for the eating, yeah, poor appetite, and later on don't want to eat any kind of food, or they may even just eating pretty small amount of food. So that's basically we're talking about anorexia. Yeah, anorexia. So clinical symptoms mainly poor appetite. And then because they reducing the food they eating, the next problem is poor nutrition. So that's the mainly. So for the TCM, yeah, TCM aspect, yeah, etiology. So that's basically we're thinking about the cause by feeding the baby not right. Yeah, feeding the baby way not right. And maybe some deficiency in there. Yeah, congenital kind of deficiency. Emotions sometimes still can cause, but not the big issue for the children. So basically, the pretty common one, another pretty common one, patient getting sick, yeah, children getting sick, then damages spleen function because their spleen functions is weaker, then poor appetite, then they eating less and less and less. So that's the mainly issue. So 脏腑 relationship with the illness mainly is spleen stomach kind of difference. So function of the stomach, received food and the digestion food. And the spleen functions governing the food acids T and T, sending to all over the body. So that's basically the issue. Then we're talking about the different pattern relationship under the treatment. So we say that mainly is a spleen issue, spleen dysfunctions, then TNT not working. So the symptoms for this pattern certainly poor appetite, and they try to eating less food. Yeah, don't interested for food, and feel the food tasteless. Yeah. And also maybe some stomach ache reverse the symptoms, like a beachy, nausea, and stomach distension, and feel fullness in the abdominal area and the stomach area. So these patients, like they don't want to eat because after eating, all the symptoms is severe, like more fullness, more distension in the stomach area. So that's basically generally start stage. So during that time, patient's constitutions may be still normal, spirit still normal, and the daily habit activity still normal, but mainly just poor appetite and with some nausea, stomach distension. So that's spleen deficiency. Yes, spleen deficiency. If we look at patient tongue, a pale tongue, and thin white coating, or maybe little bit thin yellow coating, because T and T not working, body fluid retention in there. Pulse usually still kind of normal. So this pattern, this pattern is not that severe kind of pattern. Just can start from stomach function deficiency there. So that's we say it usually happens at the early stage of the illness. Stomach deficiency, then people don't want to eat, poor appetite, and less eat. So that's why we're talking about the normal spirit and the normal constitutions. Body still kind of normal, look like normal. But later on, it pretty easily to changing to other pattern, and then more damage the bodies, and then changing to chronic illness. So treatment principle, certainly we need a harmonized middle gel, spleen stomach, and increased appetite. So poor appetite is the mainly problem. So we build up middle gel and increase appetite. Backrow of the spleen, backrow of the spleen. Stomach 36, still working for spleen stomach. And the spleen 9 relieve some dampness with the TNT not working, some dampness accumulation. And the spleen 6, 3 channel meeting points. So we are not only working for spleen, we're also working for other 2 in channels. Certainly, yuan south points of the spleen still working, spleen 3. So we need more spleen tonified. And certainly if we try to more regular middle jaw, Ren will be helpful. So we can use even technique or tonified technique. Usually we are not keep needles, just insert needles and manipulation needles and then we start it. So treat once a day, 5 days as a one treatment section. So that's the first pattern. Then we talking about the spleen stomach qi deficiency. So basically this pattern kind of development from spleen dysfunction. Yeah. When spleen dysfunction stage is not that truly damaged spleen qi, just losing some function. But truly later on, they may development to the qi deficiency pattern. So these pattern symptoms compared with last pattern is a little bit more severe. So poor appetite and eating less, don't want to talk, qi deficiency. So damage qi already. And shallow or dull face, slightly emaciation, losing some nutrition already. And profuse stool, profuse stool, sometimes losing stool. Yeah. And also with undigested food inside. So that's spleen qi, severe canal damage, couldn't handle or couldn't digest food. Pale tongue, deficiency tongue, tongue coating not truly changing. Pulse is weaker. Not necessarily too slow, not necessarily too slow, but generally weaker. So this pattern, we say basically happens, basically happens with spleen dysfunctions and gradually cause the spleen qi deficiency, then cause the patient don't want to eat. So that's basically. So this kind of weaker spleen and the stomach happens in the children, or particularly happens in the children. Or maybe they have some chronic disorder, illness, especially for like spleen dysfunction, chronic spleen dysfunction, like we talking about the first pattern. So truly this pattern compared with the last pattern is a little bit severe. It's damaged some qi function already, like a patient fatigue and slightly emaciation. So treatment principle will still tonify the spleen functions and tonify qi and help T and T function. So the points, we go to back shoe of the spleen and the back shoe of the stomach, and the stomach 36 and the spleen 6 still working. So these two patterns, this one and the last one, we still can use massage. Massage still good. Still good for tonify. That's still good for tonify. So still once a day with tonify technique only, or even technique, and still use 5 days as one treatment cycle. Then we talking about the pattern, stomach indifference. The symptoms for stomach indifference. So still poor appetite, don't want to eat. And also we have deficiency heat signs, dry mouth, dry throat, and thirsty, and dry skin, dry stool, constipation. And patient, they have like a less urination, infrequent urination, less urination, yellow urination. So that's still heat in there. And can have 5 center heat. Plums, 2 plums, 2 cells, and the chest, 5 center heat. We talk about indifference. And sometimes, some impotence, irritability. That's the internal heat symptoms. And don't want to sleep, don't want to sleep, or cry during the sleep, sleepless. So the tongue is a little bit red and dry, and maybe pale coating, partly, usually it's pale. So partly pale coating, sometimes we also call geographic kind of tongue coating. And the pulse is weaker, serrated, thin and weaker. So that's mainly stomach indifference pattern. So this kind of situation usually happens on the genetic kind of disorder, genetic kind of indifference. Or maybe sometimes they especially eating some spicy food for a long term and then damaging, and maybe got some illness, patient fever, and then damage body fluid. So that's some reasons. So clinically, they eating less. That's the illness we talked about. But they drinking more because indifference, damage body fluid, and they're dry mouth, dry throat. So they're thirsty. They try to drink more. And the patient also have dry stool kind of constipation. 5 center heat, red tongue, with scanty coating, we talked about already. So treatment, we say nursing in, build up the spleen, stomach, and promoting TNT functions, promoting the appetite. So generally say these points still lot of tonified points. And we also thinking about some kidney tonified points. We say body mainly controlled by kidney. So kidney 6 still good. And the PT6 with ren 12 together, regular middle, regular middle. So that we still mainly use tonify technique and still do it daily for 5 days as a treatment session. So indifferency. Use massage or without use massage. That's always we need thinking about individually patient's condition. So deficiency in massage is good. That's tonified. But deficiency maybe generate some heat. Heat not good for massage. We say massage generate more heat. So generally say we are not massage for heat condition. So clinically we need to see patient more deficiency or more heat in there. So more deficiency we still can massage, but try to pick up some points on the lower part of the body because heat easily rising up. So like a kidney 1, it's a good one for massage. And also like a stomach 36, it's good for massage. And spleen 3, even spleen 6. So we still can pick up some points for massage. But generally say we are not massage in the upper part of the body. Don't like generate too much heat. So that's for this part. Then we're talking about prevention. So prevention is very important for infants. So keep the infants eating healthy and keep the healthy eating habit. So like including give infants gradually get some multiple kind of food and keep the same amount of the food for eating. And when children have a kind of a poor appetite, then try to find what's the reason cause that problems and remove the reasons. And also pay attention to other like mental things or whatever others affected the infants, like eating habit there. So before they getting worse, we try to get some prevention. And the nursing care. So basically, try like infants eating too much, especially for junk food. What means junk food? Too much sugar inside, too oily, too sweet, and even too spicy. Yeah. So basically, we keep the balance of the food for different kind of flavor, and balance the amount the people eating, and try to avoid some food difficult digestion. We're talking about infants or children. Their spleen pretty weaker, their stomach pretty weaker. So that's if eating too much, they still hard to digest it. And also try to avoid to eating too much cold or raw food. not too oily, not too oily. So this kind of food generally say is more damaging spleen stomach functions. So try to eat, not eating too much. So if children, truly have some poor appetite already, so we may can give the children a little bit food like they pretty like to eat, and then like make their interesting to eating. Then we give their balanced food later. So that's gradually increase their appetite. And also especially for the children, when they have like a poor appetite, context for genic like a function, like levels, yeah, go to laboratory test. So generally say if patient have deficiency, yeah, kind of minerals deficiency, so that may cause the poor appetite. So we can give some more food contains fat, like some milk, egg yolk, and also lean meat, fish, animal organs sometimes contains more that nutrition, and also beans and nuts. But for the nuts, be careful. Some children may be allergic for it. So that's generally for these